Primary Care and Lifestyle Medicine is the first and only direct primary care practice in Rochester area. We opened our doors on January 3rd, 2022, and we're open for new patients. So direct primary care is alternative, innovative health delivery payment model, and it brings together the patient and the physician. And by cutting out the middleman of insurance coverage, it brings back the joy of practicing medicine. So direct primary care is very similar to concierge medicine. At the same time, they're very different concepts. Both direct primary care and concierge medicine bring back the direct relationship between the patient and the physician. Usually, the patient gets a direct cell phone line to contact the physician directly by texting, calling, or emailing. So it establishes that direct relationship between physician and patient. The big difference between direct primary care and concierge medicine is typically a pure direct primary care practice will not bill insurance. So by cutting out the insurance altogether, direct primary care physicians have the liberty to practice medicine the way it makes sense for the patient without rules and restrictions and regulations imposed by third parties. At the same time, concierge doctors billing the insurance will have those restrictions. That means extra out-of-pocket money for the patient who has to pay co-payments and deductibles for every visit, every time they see the concierge doctor, on the top of the monthly or yearly membership fee. So typically, when you think about concierge medicine, you think about higher earner population who can afford a monthly membership fee and deductibles and co-insurance for every appointment, as compared to direct primary care services, which are really targeted towards regular people who can afford the low monthly membership fee that typically has included all the services at no extra cost. Lifestyle medicine is my passion, and I'm super happy to talk about lifestyle medicine. Lifestyle medicine is an evidence-based medicine specialty that focuses on all aspects of human health that we can address, improve, and optimize without necessarily using pills or surgeries or procedures. So the 6 pillars of lifestyle medicines are nutrition, exercise or physical activity, sleep, restful sleep, stress management, risky substance use, and positive social connections. So through lifestyle medicine training and through American College of Lifestyle Medicine curriculum, we get evidence-based training in all these 6 pillars and how can we optimize health without using pills. And if you look at the guidelines of all major specialties, you'll see American College of Cardiology, American Diabetes Association, they recommend lifestyle changes as the first line of treatment for all chronic illness, including high blood pressure, diabetes, high cholesterol, cardiovascular disease, stroke, you name it. The first line of treatment is lifestyle change. However, throughout the medical training, in medical school, doctors get very little training in lifestyle changes. So that's where lifestyle medicine comes to complement that training and really dive deep into understanding the nutrition science and the exercise physiology science in order to make customized recommendation for each individual patient. So lifestyle medicine is improving health with lifestyle changes. So what made me decide open my own practice, and especially using the direct primary care model? I have been practicing medicine for 20 years and I've worked in all different healthcare delivery models and mostly insurance-based and corporate medicine. And I'm very passionate about patient care and having establishing that relationship, long-term relationship with the patient. And that's the main reason I actually chose to do primary care to begin with, because I do believe primary care is the backbone of care. People go see different specialists, they go to the cardiologist, the endocrinologist, so they need to go to emergency room for surgeries, but they always come back to the primary care physician, because the primary care physician is the one that puts it all together. And the backbone of primary care is continuity of care and the relationship between the patient and the physician. Well, the corporate medicine has taken that away from us, because the way the rules and the regulations and the restrictions imposed by the third parties, including the insurance companies and the corporation, really take away the time and emphasize the volume of care to see more patients every day to make up the numbers. However, physicians are left with 5-7 minute appointments to see patients face time with the patient. Well, there is no quality care and quality relationship with the patient in 5 minutes. You need the time. You need to be able to listen to patient and have the time to listen to their concern, to understand their problems. And this is what direct primary care offers. It reestablishes the patient-physician relationship and allows us to have time. I can take 30 minutes, I can take 60 minutes, I can take 2 hours, if the case may be, to really get to listen and understand what's going on with the person. And it's this kind of personal attention and relationship that builds trust over time, and this is the core of primary care. That's why I choose primary care to begin with as my specialty. And direct primary care allows me to do that, allows me to take the time without worrying about the numbers. And by cutting out the corporation and the rules, I'm able to practice medicine again. Alright, so are there ways for Athena DPC to work with small businesses? Well, certainly. In today's market of very expensive healthcare insurance premiums, the small business owners really feel the pain of paying for benefits for their employees. At the same time, the quality of the care they receive is not to the par. So what would be the ways to work together? Well, the most important thing that we can do is to save money on monthly premiums by working on high deductible plans with low monthly premium. And yes, small business owners ideally should offer an insurance coverage like a high deductible plan or a health share plan to have catastrophic major health issues addressed, like surgery or hospitalization. However, at the same time, pair this with a direct primary care membership, and having access to a direct primary care physician, having that benefit in the employer package, will make the employees very happy and very loyal to the employer, because they experience the quality of the care they receive, the attention, the personalized service. And at the same time, employees do not have to tap into the high deductible premium that they have to pay before their insurance even kicks in. So, but for just about less than $1,000 a year that would cover for the direct primary care membership, employees have the peace of mind to have 80 to 90% of their health problems addressed in a timely manner. They have unlimited services in office or telemedicine visits. For the employer, they have not only happy employees and grateful employees, they have improved productivity, because now when the employees are sick, they can get care right away. They can get that treatment right away, so they can get back on track without losing productivity days. So everyone would be happy in the end. Employees will save money on their employees' benefits, and the employees will be more productive and have better access to care.